Michael, we couldn't hear you clearly. And I think you might be on mute now.
Okay, I know this is better.
Yes, much better. Thank you.
Excellent. Thank you so much. Hi, Denis. Hello, Remy. Hi, Aziz.
Hi, everybody. So I think we can start, Anu.
Perfect. So hello, everyone. Thank you so much for joining us here today. My name is Anu, and I'm a senior researcher with the Economic Policy Research Institute. We are honored to organize this webinar on behalf of the UNICEF Evaluation Office. This is a webinar. This is a webinar in the series where we are highlighting good practices that we have identified from the global evaluation of UNICEF's social protection responses towards universal child benefits. So a few of the housekeeping rules before we start off the webinar, and I hand it over to the moderator, Denis Jobin. Please feel free to put your questions in the chat box, and you can also share any comments or resources in the chat as well. The session will be recorded, and the recording will be shared with all the participants and registrants of the webinar. In case you want to enable the English captions, that is also available within Zoom. And one last final note, please do keep your microphone on mute during the session. With this, I would like to invite Denis, who will be the moderator for this webinar. Over to you, Denis.
Okay, thank you. Good morning, or afternoon or evening, ladies, gentlemen, distinguished panelists and colleagues and friends. And I wish to welcome you to this global webinar done by Evolution Office, UNICEF, in collaboration with EPRI, based in South Africa. As we gather here today, our shared objective resonate with the profound sense of purpose. UNICEF, alongside with our development partners, is resolute in fostering partnership with international and regional institutions and funding agencies. The goal is clear: to mobilize additional resources for providing comprehensive, sustainable social protection coverage for children across the globe and expanding child benefit. Today, we stand exploring not just the significance of this collaboration, but also the tangible impact they have had through two UNICEF success story. Two or three, yeah. This narrative underscores the power of partnership in mobilizing resources and supporting countries to design, finance, and implement effective child-sensitive social protection programs. Our first highlight takes us to Tunisia, where UNICEF partnership with the World Bank exemplifies a pivotal alliance. This collaboration, supported by the Tunisian government in introducing and expanding the Child Allowance Program amid socio-economic challenge. The journey involved overcoming financing hurdles and leverage the partnership to generate evidence and engage in effective advocacy. One of the critical outcomes was the approval of a $300 million loan to the government of Tunisia to extend the monthly child benefit to up to 125,000 additional children between the age of 0 and 5. Moving eastward to Mongolia, UNICEF partnership with the Asian Development Bank present another model of success. The collaboration focused on building and gathering evidence to support the government in expanding the child money program by producing complementary evidence based on the program impacts. This partnership has fueled advocacy strategies and informed policy making, enhancing the sustainability and expansion of the child benefit in Mongolia. These stories are not just the narrative of success, they are blueprint for action. They guide us as we delve into discussion today, led by expert and panelists who have been at the forefront of this initiative. For examining financing challenge and strengthening social protection system to explore innovative strategies, for mobilizing resources in the face of future crises, our agenda is packed with full insight and discussion today. As we move through the agenda, the closing remark will be done by Dr. Michael Samsung from EPRI. Each segment is designed to foster deep understanding and collaborative thinking. Our panelists, including Remy Pidjos, Mohamed El Aziz Ben Gashem, Moktul Batar, Iktel Longji, I apologize if I have difficulty with the name, will share their insight on leveraging partnership and shaping advocacy strategy and evolving the role in UNICEF in fostering these critical collaboration for child-sensitive social protection system. Our first panelist, let me introduce, is Mr. Remy Pidjos. He's currently the social manager, UNICEF Tunisia. Remy is an econometrician who holds a pre-doctorate diploma in mathematics and econometrics from La Sorbonne. Over the past 15 years, Remy has supported UNICEF engagement in the field of social policy, research, and regional office for West and Central Africa in Chad, Senegal, and Ethiopia. So thank you for being part of this important conversation, and I wish you all a successful webinar. Over to Remy, please.
Thank you very much, Denis. So thank you, colleagues. Thank you for organizing this webinar. So I'm going to present the case study from Tunisia, where we have been able to work closely with the World Bank and donors to start modeling and implementing at scale the child benefit for children under 5. And since the last 2 years, we are also partnering with the World Bank and other donors to support the expansion of the child benefit to children 6 to 18 years old. So next slide, please. So I'm going to focus my presentation on the financing aspect of this child benefits. So for everyone listening to this presentation, I will give a quick overview of the national context. So even before the COVID-19, Tunisia was facing quite substantial socioeconomic challenge. So there was rising disparities in the country. Income inequalities also were one of the concerns, and another concern for the development of the country was the level of youth unemployment. And as you can imagine, these challenges were aggravated by the COVID-19 pandemic in the country. So in 2020, and Tunisia was one country in the MENA region facing one of the largest GDP decline in 2020. According to the national estimate, in 2020 there was a decline of more than 9% of GDP. So this decline in the economy in 2020 was generating job loss and income losses, and driving many households into poverty. In 2020, UNICEF Tunisia did support a simulation exercise of the impact of the COVID-19 and the economic disruption on the child poverty. And according to the estimate we did in 2020, there was about a 10-point percentage increase in child poverty in 2020. So rising from 19% in 2018 to about 29% in 2020. So it was meaning that for Tunisia, there was about 1 million children living in monetary poverty, setting the progress of the country in back by about 15 years. So it was a massive impact on child poverty. Because of this overall economic situation, the fiscal space in Tunisia was already tight, and because of the impact on COVID-19 on the economy, this fiscal space was even more constrained because of the increase of the debt, and also because the revenue of the state fall down because of the economic decline. And at the same time, the country was putting in place mitigation measures to the impact of the COVID-19. And unfortunately, these first mitigation measures were not child sensitive. And that's where UNICEF started working on advocacy. Next slide, please. So before the COVID-19, UNICEF was engaging with the Ministry of Finance, the Ministry of Economy, and the Ministry of Social Affairs to advocate for a universal child benefit, because the universal child benefit is part of the social protection floor vision for the country. So, as I said already, poverty rate for for children was already quite high and aggravated by the COVID-19 in the country. Child poverty is about the double than the rate for adults. In some inland region of the country, child poverty is above 50%. So meaning that 1 out of 2 children in this region are living in monetary poor household. And at the same time, the coverage of social protection for children is quite low, because more than 40% of this of the Tunisian children are not covered by either contributory or non-contributory social protection scheme in the country. So we did 2 main studies before COVID-19. So in 2019, demonstrating the feasibility of the social protection floor vision in the country, and also focusing on the feasibility of the universal child benefit. In the country, this is the case in many MENA countries. The social protection sector is dominated by subsidies, general subsidies, especially the one related to fuel and food subsidies, and they have a huge weight on the national budget. To give you a sense, the general subsidies cost about 4% of the national budget in 2020, compared to less than 1% on social transfer to poor and vulnerable families. And at the same time, these subsidies, while they are very costly for the budget, they are not cost effective and they are not equitable in poverty reduction. So these 2 studies that UNICEF supported with the Ministry of Social Affairs and with national institutions demonstrated that the universal child benefit will be more affordable in terms of cost for the national budget. And this program would be also more cost effective in terms of poverty reduction, and will be more equitable if in place in terms of redistribution to the poorest quintile of the population. Next slide. So again, I would like to insist on the fact that UNICEF was working with partners before the COVID-19. So demonstrating that the UCB will be more progressive because we have more children in poor household. As I said earlier, was more cost effective than the subsidies. Was a way to attenuate the last 10 years of negative social impact of the economic downturn. It was also a way, because there was a plan for a subsidy reform, was a way for the country to mitigate the impact of the subsidy removal on the poorest household if this subsidy reform was putting in place. Putting in place also a child benefit in a country like Tunisia, where we have existing system, social protection system, we have existing registries, was also quite simple from an administrative perspective. And the most important point for the Ministry of Finance was also affordable, requiring only a modest proportion of the fiscal space that the subsidy reform could create. Next slide, please. So, based on this background, on the context of the country, the massive impact on child poverty of the COVID-19, UNICEF was able to mobilize about 26 million from the KfW and the government of Germany to support the implementation of the child benefit. So the feasibility study I mentioned earlier in my slide was making a recommendation to put in place a monthly child benefit of 30 dinar per month per child, so about $10 per month per child, to effectively address the issue of poverty, of child poverty in the country. And so with this funding from the German government, we were able to launch the child benefit for children 0 to 5 years old, also to double the government back to school allowance. So every year there is a back to school allowance for poor and vulnerable household in Tunisia. And so with this funding, we are able to double the amount that the families were receiving. And so with this funding, there was an agreement with the Ministry of Social Affairs, which is the main institution, the national institution in charge of implementing the national safety nets in the country. So we were able to launch this child benefit through the national system. And we started at the end of 2020 with about 40,000 children under 5. And at the end of the program supported by UNICEF with this funding from Germany, we were reaching about more than 120,000 children, representing about 12% of all children under 5 in the country. During the implementation of this model and program, we were working closely with the World Bank and the other partners of Tunisia to produce evidence and to document the impact of this program. So, for instance, we put in place regular data collection on quarterly basis through panel phone survey, and we did also a proper evaluation of the program. So the evidence collected during the implementation were quite convincing in terms of impact, and we were able to engage with the World Bank and JICA to leverage about 50 million through a loan to Tunisia to continue the program in 2022, and as of today also through a loan to the national budget of Tunisia. And the child benefit target and the evaluation that UNICEF was producing were disbursement indicator of the loan from the World Bank, but Azil will explain a bit more on that aspect of collaboration. So at the end of the day, this child benefit was institutionalized in January 2022 through a decree signed by the President. And the child benefit vision, so covering all children from birth until 18 years old, is now part of the National Development Plan for 2023-2025. And UNICEF and the World Bank are also now collaborating to support the expansion of this child benefit, this model of the child benefit, to the group of age 6 to 18 years old children. Next slide.
Remy, 1 minute left.
Yeah, that's my last slide. So as I explained, we put in place data collection through panel phone survey, impact evaluation, and this is the key finding which were supporting the advocacy that UNICEF was implementing in the country in partnership with the World Bank and the other donors. So key finding of this evaluation, the child benefit under 5 implemented during a year and a half had impact on nutrition situation of the children, on schooling, especially on preschool attendance and registration, access to healthcare for these children and for the families. We were able also to document an impact on the mental well-being of the parents of these children. So the child benefit with the regularity of the transfer was improving the mental well-being. And one key finding also of the success story of this child benefit was the choice UNICEF made at the beginning to implement through the National Social Protection System, and the role of the social worker in Tunisia has been key in the implementation and the scale-up of this child benefit program. Thank you so much. That's over from my side, and I will hand over to Aziz for another perspective from the World Bank.
Thank you, Remy. Indeed, over to Aziz. It's a good transition, and we're gonna have a time for Q&A now. So let's move with Aziz, please.
Thank you, Denis, and thank you, Remy. Good morning, everyone. Good afternoon.
Maybe I should introduce you, Aziz. Sorry, I forgot. Right. So Aziz when you prepare yourself, when you upload your PowerPoint, Aziz is a senior social protection specialist in the social protection and job global practice at the World Bank in Tunisia. He is currently the task team leader of an operation and a series of technical assistants that support the Tunisian National Social Safety Net program. Children and around of 0-5 years old of poorest household and the policy dialogue related to social protection reform. Okay, over to you, Aziz.
Aziz, you are on mute.
Thank you a lot, Dennis, and good morning, good afternoon, good evening for everyone, depending from where you're joining. So I'm Aziz Barashem, Senior Social Protection Specialist at the World Bank in Tunisia and Task Team Leader for the operation supporting the flagship Social Safety Nets program. And first of all, I would like to thank the EPRI and UNICEF for extending the invitation to allowing the World Bank giving the testimony of the insights and the successful collaboration between our two institutions supporting Tunisia on the social protection agenda and specifically on the topic of child benefits. Let me start with some context elements. Please, next slide, Anu. So Tunisia has started its non-contributory schemes in the 1986 with a national program for the elderly and the poorest one, with mainly cash transfer services, but also free and subsidized healthcare programs. Since then, the World Bank joined the social protection agenda with some grants and the policy dialogue, which is supported the Aman law. Aman is Arabic and safety. It's safety in Arabic, sorry. So Tunisia has issued an organic law defining this new program based on the former program. And the Aman program was revamped as multidimensional services alleviating the poverty, as you see on the right, with permanent cash transfer to the poor, free health card and subsidized health card, back to school allowance, cash transfer for religious celebration, one-off assistance as temporary cash transfer, but also some services for generating jobs and income sources. The 0-5 years old child benefit is the testament to the successful partnership, and I will go further in details on the next slide. Next slide, please. The Tunisia economic has very challenging situation since let's say many years, but it was aggravated with the COVID-19 crisis, in addition to the Ukraine war, which has had an impact on the distribution of food and energy products, but also the droughts. And as you see on the right, the growth on GDP was very low and is still low after the COVID. And as you can see in the 2023, the main sector who has declined is the agriculture due to the drought, which has an impact for the poorest and especially agricultural workers and the rural area. So, and the second graph was to showing the inflation percentage increase year to year, over year. And you can see that the food inflation is going higher and the inflation is going rising through years. So this had an impact, a negative impact on the poverty, and Remy was already given these figures. So, but these arguments advocated for enhancing the expansion for the social assistance program, the non-contributory schemes, an horizontal but also a vertical expansion for the number of beneficiaries, but also the allocation and the amount of benefits. And since more than a decade, Tunisia had envisioned to implement the universal child benefits, starting with the poorest and most vulnerable households, before gradually expanding to cover all Tunisian children. Good progress has been made towards achieving this goal, and our joint effort with UNICEF, which was based on our shared expertise on social protection since years. Next slide, please. Another challenge to have in mind for the design and the response that we provided to the Tunisia context in collaboration with the Tunisian government, that the contributory schemes has already some child benefits, but they are very insufficient for the poorest and most vulnerable population, which is providing a very low allowance per child and limited for the number of children. On the other hand, the non-contributory schemes, as I said before, that aiming to expand progressively to the poorest, is aiming to have all coverage of the children in the non-contributory scheme and giving them 30 dinar per year per children per month. And as December 2023, over 140,000 children was benefiting from the allowance in the Aman social program. Next slide, please. So to respond to these challenges, the World Bank with the Tunisian government has agreed to have this operation, which is called Tunisia COVID-19 Social Protection Emergency Response Support Project. First tranche was about $300 million with a top-up of $400 million in the year of 2022, which is in total $700 million. And including three components. The first one is on the cash transfer to mitigate the impact of the COVID-19 crisis, including the temporary cash transfer on one shot for not more than 80,000, it's about 900,000 households. The expansion of the permanent cash transfer from 8 to 10% of the total population, and enhancing the targeting and less discretionary conditions to be based on data cross-check, on social surveys, and scoring to rank the beneficiaries. The second component, which is about $60 million, was about cash transfer for the human capital development. And this was incentivizing the support of institutionalization of the family allowance 0 to 5, capitalizing on the engagement of the UNICEF 1 year before, and I will go back to that. To support the cash transfer plus with accompanying measures to have better impact for the children and their families, and also enhance their digital payments for this cash transfer to make it easier for them and have a financial inclusion. And this is an area where we are working also with UNICEF. This component also co-financed the family allowance 0 to 5 during all this period. For the third component is about strengthening the social protection system to strengthen their governance, support digital transformation for the social registry, strengthen the monitoring and evaluations mechanism, the grievance redress mechanism, and communication, institutional, but also for the beneficiaries, to better outreach the beneficiaries and to know their rights in this program. Next slide, please. So our collaboration was very successful and very complementary. As I said, UNICEF started with KfW funding during 2022 for this family allowance 0 to 5, and then the operation of the World Bank came to institutionalize, after institutionalization of this family allowance, to finance the children 0 to 5 allowance, and it helped the families to have more money, especially on this period of crisis during the COVID, but also, as I said, during the Ukraine war and the droughts, which is enabled to have a modular benefits for the families in addition to the permanent cash transfer. So the amount was adapted, more adapted, let's say, for the family composition and their needs at the end, and to be more resilient facing this inflation and the shortfalls on some products. This operation also helped to convey some other donors for supporting this effort of Tunisia to implement the family allowance, and the JICA come in to support also the family allowance in addition to the permanent cash transfer for the families. Next slide, please. I will end here to say some key factors that allowed us to have this success partnership with the UNICEF and the Tunisian government. So we built on the clear government strategy and orientation on the cohesive vision that unite stakeholders and facilitate collaborative efforts toward shared goals on this unified child benefits, but also on social protection and building this MN program. This is the first factors that all the partners are around with the government. In our institutional side, we had an MOU with the UNICEF and the World Bank signed in 2017, which defines the scope of intervention, avoiding the overlapping, sharing our knowledge, and build a strong partnership to support Tunisia. So the collaboration had also many other aspects, and we work very well with UNICEF on several parts. We had several technical assistants for the government on digital, on monitoring and evaluation, for the panel surveys, sharing data, but also we established last year a coordination with a multi-donor platform, which is shared by the World Bank and co-shared by UNICEF and the European Union, and including all the partners working on the social protection in Tunisia, which is very useful to share the intervention, avoid the duplication. And the mix also is a very strong tool, especially that Tunisia is using it since years, and the data has an anchor in the government, and they are accepted by all the partners, and we can build on it and inform the process of decision making and evaluation of the social policies and social programs. So this is a very useful also tool, and it's very important to stress out this. I will finish some words on our collaboration with UNICEF in Tunisia, that in addition to all these technical aspects and institutional arrangement, I think that the strength of our partnership with the UNICEF is further reinforced by the personal relationship we have developed throughout the years with the team, and that together we continue to work towards creating a positive impact on the lives of Tunisian children and their families, and hopefully in the systems for Tunisia. Thank you, everyone.
Thank you, Aziz, for sharing your insight. And
I think there's a video from the UNICEF Tunisia office that we wanted to play after this.
oh yes, okay. So over to you.
كوفيد قتلنا، مش أثر فينا برك. احنا ولينا معاش حاطينه حتى المات اللي خاطين عليه جملة. أنا تحس روحك في بلاصة ماكش قادر مش حتى تتنفس، تفكر عليك الباب، تشوف صغارك، تخمم في الماكلة، تخمم في الكوش، تخمم في هيك، يعني ضغط كبير برشا. والله وقتها راسلي مرض حتى مشاش للطبيب، ما عناش معناتها باش نمشي. وصغاري زادوا مرضوا وانا مرضت قعدت نمشي شعبانة تحتية.
تقريبا قعدنا برشا ما نخدموش. باش تمشي تنتقل تمشي تخدم مواعيد ما تلقى فيش تركب. مرضت بالكوفيد قعدت 3 أيام وفزت نخدم. باش تقعد معناها بطلت. معناها الصغار باش يقعدوا للشر.
زعما باش نبطل من المكتب باش تشد لي ولدي ذاك الصغير من تعبان باش نمشي نينس باش نعاون شوي. ساعات يوم اللي صغير ما نلقاش باش نهز. يوم اللي شتي هكا يقعد لي يرتاح واحد. بالنسبة لقبل عايشين في ظروف صعيبة وتوا عايشين في ظروف صعيبة، ما إذا كان ما جاتش ثم المساعدات متاع 30 دينار راهم هذوما الصغار الزوز ما همش يقراو في التحضيري، معناها ما يمشوش يقراو هذيك بس اللبسة متاعها متاعها شوية ما توا تحسنت. المردود متاعها ودور الإيجابي تاع المساعدة هذه لا جدال فيه، إنما انسفيزون يلزمها تتواصل باش ما نعملوش كوبور، معناها مش توا نعاونوا كان نجموا نطلعوا شوية في السقف باش المردود يكون معناها إيجابي أكثر. كي نجيبوا مثلا 60 دينار خلص مثلا لومجة على قراية وخلص منهم باقي فلوس، أنا من كل مخنوقة على الآخر نحس روحي خفيفة شوية. هذيك 30,000 في مرت أنا عزوز صغار كل شنت 60,000 بنين. أنا حاجة شنت نقصتها حاجة باش قرارس حاجة يكمل يشري لهم فطورهم بمشتهم عاونتني شوي. That UNICEF supported with the partners to children of vulnerable families of less than 6 years has been really a pioneering approach. And it has indicated to us the urgency and the importance to address child poverty in Tunisia, which was particularly affected by the consequences of COVID-19. This calls us to do more, to invest more efforts at all levels to address all children, all vulnerable children through a cash benefit approach, and ideally in the long term with the universal child benefit approach. We know this is affordable, we know this is sustainable, but it will require that important decisions are made to make the necessary economic reforms, but it will be really able to lift up the level of the country and particularly to lift up the level of families who need to move out of the current dramatic situation in which they are living.
Thank you, Remy and Aziz. That was a wonderful video and story to share. Let's move over to Asia now with Mongolia partnership with ADB and over in generating evidence under this partnership. So I'm presenting Moktul Bataba, sorry if I misspell, Chief of Social Policy of UNICEF Mongolia with over 20 years of experience in development economics. Yes, thank you. And public finance management. Her expertise span the development and implementation of fiscal policies, budget framework, financing reform across various sectors. So over to you, my dear Moktul.
So thank you very much for our UNICEF HQ colleagues and then also the organizing institution that putting us all in together. So greetings from Mongolia to everyone. So the leveraging partnership with the IFIs to produce evidence that informs policymaking and financing, we would like to highlight, next slide, please. The UNICEF with this strategic plan for 2022 and then until the 2025 goal areas, we are basically kind of built on during the what we has achieved, and then struggled to overcome the COVID period and then what we have learned. And then we are strategically focusing on the 5 areas: health and nutrition, education, child protection, wash and clean air, and social inclusion and evidence. So in all these 5 areas, we are partnering with different partnership, trying to promote more like engagement with the partners, not only the financially, but more on bringing together the expertise and then trying to achieve the objective towards the child rights for children and then the results. The next slide, please. So in the social inclusion and evidence, what we are trying to, see and then trying to have a situation in Mongolia is like we are in times of, not just in the over the last years, but still now with the child are deprived, at least 3 to 4 deprivations are overlapping, and then we are really trying to see that how we are going to strengthen the national social protection system in a way that we are trying to strengthen more of a continuous and sustainable cash transfers, and then the social protection services are in place. And then on the other hand, we are really trying to push forward the public financing for children, like more increased investment for children, more evidence generation that the informed leveraging the budgeting and public finance into the social protection system, so that, we have better resources to allocate and then distribute. And then the evidence generation for evidence-based policies, and then programs to track poverty, and then the child-related deprivations can be resolved in both national and subnational levels. Next, please. So when we were programming and then assisting the government of Mongolia, the child money program was started with the initiation of the UNICEF. And if you see the graph, like from the 2005, the evolution of the child money program was really kind of a really unstable. It was like more of a political agenda, and then it was like pro-cyclical decisions against the, in line with the budget availability and the fiscal space. And then so as UNICEF, we are trying to pitch the government of Mongolia. This is the only useful and then the universal social program that can be really achieved, so that there is no one left behind. And then this is really how we can really enhance the outreach. Especially the Mongolia is a very diverse, which is like very much prudent to external shocks with the natural disaster incidences, and then as well as the economic shocks are quite affecting to the Mongolian economy, so that in a way that it is the only program that can really alleviate poverty or really mitigate poverty for the household cases. So this program has undergone many changes in design of coverage, targeting measures, and then with the conditionality approaches. And then the last battle with the government, how we are really trying to put in the discussion was, it was the COVID-related increase, which was increased like 5-fold. And then we tried to really bring it up, convince the government just put back and revert back to the universal, as well as the increase was kind of a really, they're trying to see the fiscal space was not enough during the COVID period, and then how we can sustain in the future. Next slide, please. So I would really like to highlight back to our discussion that how we are really bringing the social programs and then integrating and then bringing efforts from the international finance institutions and then donors. So when we see the COVID pandemic, when we were just fivefold in the increase in the child money program, we were trying to make a little bit of a simulation, like micro simulation results we were trying to bring up. And then we have collaborated with the ADB in a couple of ways to bring not only the financial support, but that kind of bringing the evidence, and then also how we are really target which programs we have to be targeted, which is the most effective. So in COVID, the 66% of households with children saw a drop in the household income due to the lockdown. As the household income decreased, the income structure changed. So in the when we run the short-term simulation, there's on the short-term impacts, we were seeing really kind of a impact for the households that only pulled the households from the poverty line, the poverty threshold, we see that the consumption has been really affected the households, even in the consumption trend, that not only it's, you know, provided securing the financial the gaps, but as well as we're seeing the trend of more investment and then more saving to the children. Like half of the households spend more than food consumptions. 1 of every 3 households spend more in savings for children, and 1 in 5 households spend more in children on clothes and non-food items. So what we are trying to see and advocate globally is more money we spend on the children. It really goes on into more savings. It really goes on more investment to the education for even the children's development, etc. So it's you know, overcoming the challenge of like, okay, defining the defined objective and then design and implementation modality or long-term financial commitments. We could really bring up a good example and demonstration of how it can really be benefit in lots of other terms. Next slide, please. So apart from the simulation, you know, there's the ADB project on the shock responsive social protection. It was really, they had really facilitated, and then they had, you know, discussed, and then even the government requested the ADB to redesign the project into converting the cash money programs so that, you know, they can really move and then take an immediate action during the COVID. And then with this implication, we really now see, as of 2024, when we look back, we see that how the child money program can replicate the system readiness facilitated additional financing support during a crisis, that we can really further see that it can be a sustainable system to use as a shock responsive social protection. And also, we also see that monitoring of shock responsive, we can be really done through the you know, child money program, etc. So throughout this exercise, throughout the collaboration, we really see that in the further hand, in further way ahead, that these kind of joint efforts are really useful to take the policy dialogue into the next level, as well as when the designing, financing, and implementing, this is the most effective way of dialogue. So this is really kind of a, you know, joint effort. We've picked through 1 or 2 programs, including the food stamp program. But in the social program area and the social policy areas, we really do think that, you know, it is really globally. We are happy that it's really elaborated and then highlighted a good program as a good program example. So this is the end of the short. We've given a very short time, so we can we are open to questions and discussions. Thank you very much.
Thank you very much, Montel. Very interesting presentation. And now we move to our last panelist from ADB. Iktel Lamjid. Iktel Lamjid is a senior social sector officer at the ADB Mongolia Resident Mission of the Asian Development Bank. She designed and administered the project in education, social protection sector, and support the portfolio administration in the bank in Mongolia. So please welcome, and over to you, my dear.
Thank you. Can you hear me?
Yes.
Hello? Oh, okay, good. First of all, thank you very much for inviting me to talk about our partnership with the UNICEF and ADB on the specific programs which have been supported by ADB during the time of the COVID. So first, I'd like just to give some highlights of the program or support provided by ADB, particularly for these two social assistance programs implemented by the government. So the project name was the Shock Response Source Protection Project. And this was an emergency assistance loan and was requested by the government of Mongolia. And the project financed the project of applied the shock response social protection principles on temporarily to temporarily expand food support and cash transfers using the targeting and delivery systems of two existing national programs, Food Stamp Program and Child Money Program. So basically, the design of the project was quite simple because these programs were already existing, and then design and the implementation arrangements were already in place. Yeah. So the project had two outputs. One is to basically finance a temporary increase in the monthly benefits level of the food stamp program beneficiaries for 5 months. So at the start of the program or before AGP support, there were 44,325 families enrolled in the program. And at the program completion in October 2020, the number of households have increased to 44,508. And then the amount of the food stamp was 16,000 per adult and 8,000 per child per month. With the top-ups supported by the AGB, these benefits have been doubled to 32,000 per adult and 16,000 per child per month. And this program was a targeted program. And using the proxy means testing, it targeted the poorest 5% of the total households. And under the output 2 of the project, AGB has financed the share of the temporary increase in the monthly benefit level to all children who benefit from the Child Money Program. And the benefit was extended for 6 months only. And Child Money Program is a universal program that used to provide 20,000 tugrix to all children from until 17 years old. And at the beginning of the program, there were 1,007,000 children. And then at the completion of the program by October 2020, the number of the children has increased by 6.3%, or to 1,177,000 children. And then after completion of the program, government has also requested additional support to continue the Child Money Program because the COVID impact still existed and the government still continued their support. And then ADB has also processed the second project, Shock Responsive Social Protection 2 project, which actually supported 7 months of increase of child grant benefits in 2021. And the amount of that loan was 40.6 million. And then with this additional support, the number of the children that benefited from the CMP was 1,220,158 as of December 2022. And then, as you know, the government has still continuing the implementation of this program, universal program, but instead of reducing it to 20,000, they have kept and continue giving 100,000 tugrix per child. And then the project was able to demonstrate the effectiveness of adapting shock-responsive social protection mechanisms to respond to the severe socioeconomic impacts of the global pandemic. And topping up existing benefits and using existing benefit delivery mechanism allow the government to respond quickly and on timely basis to reach out 80% of the population with cash support during the pandemic. And at that time, the Minister of Labor and Social Protection actually requested ADB and the UNICEF to conduct two types of studies. One was to assess the indirect assessment of the theoretical impact on poverty and inequality of the social protection policies implemented by the government of Mongolia. And then this was done by ADB. And the second survey was a survey of beneficiaries of government support to understand how well the schemes have been implemented and what has been their use as well as the satisfaction of the beneficiaries. And this was done by the UNICEF. The two studies were complementary and together provided a comprehensive insight into effectiveness of the social protection policies implemented by the government of Mongolia. Two studies combined also provided guidance for further adjustment to the policies in the transition from the crisis to recovery. And then the combined evaluation, of the government social protection measures to address COVID-19 actually helped the government to decide to continue child money program top-ups as an effective and proper response that was able to rapidly reach a large share of the population. Yeah. Okay, so this is, basically in short what we have about the program itself and also our collaboration with the UNICEF. And then last slide is, just to respond to the question that I was asked to answer. I think there are several ways of partnering with UNICEF and further increasing our collaboration, especially in the social sectors. So, AGB has been working UNICEF in various areas, not just in Mongolia, but also in other countries. And the first proposal or the way to continue our partnership is to do these joint studies, to assess the situation and progress, to understand the achievements and evolving challenges, especially related to social programs, just like child money program. And then the second area is advocacy and awareness, to develop capacity of advocacy on social protection issues and to integrate the perspectives, voice, and ideas of the disadvantaged groups into policy discussions and with policy makers. And in Mongolia and also in other countries, AGB works closely with UNICEF in the area of disability inclusion. And then also, there are a lot of opportunities for the agencies to work together on the actual implementation of the specific projects and programs in the social protection. And for example, I recall that some years ago, we have jointly, UNICEF and AGB have jointly supported the Ministry of Health, for example, to distribute the macronutrients to all children nationwide. The same type of efforts are also being implemented in other countries, like in Armenia. For example, UNICEF and ADB have developed a new e-disability system. And then we also consider that UNICEF is a very good institution that generates the very good knowledge product and produces good practices. So there are a lot of opportunities for us also to apply the UNICEF's good practices, experiences, apply them in our actual projects. For example, we've had projects to improve the school dormitory facilities, and then there were like joint agreement with UNICEF, under which the UNICEF wash facilities, have been adapted, and the specific trainings have been provided by UNICEF to the users of the schools and others. And also in our inclusive education, supporting inclusive education program, the UNICEF good practices and experiences and learning materials were extensively used. And also even under ongoing education programs, the UNICEF good practices are extensively being used to develop and introduce the online learning and learning in others. Yeah. Okay, so this is the end of the presentation. Thank you very much. And then at the end, I'd like to just specify that AGB always appreciates UNICEF support and eagerness to work with us. And then I'd like to emphasize again that ADB works very closely with UNICEF in Mongolia, especially in the social sector projects. Thank you.
Thank you, very insightful, and we do value partnership, and this is why we're doing this webinar as well. It's very important that we engage with different partners, in this case with IFI, the World Bank, ADB, and others. So this is time now for the Q&A. I don't know, Anu, if you pick up some questions in the chat, so I invite the participant to either raise their hand, I don't know if I will see it, or to put a question in the chat. And I know, Sonia, you will help me with this. You may want to indicate as well which panelists you want the question to be addressed with.
Great. Maybe the first question, I think it's from Same, and I think it's to the Tunisia colleagues on how can we ensure sustainable funding for the Tunisia child benefit going forward, even after the 2 years that has been currently funded.
So perhaps I will start, and I will give the floor to Aziz after. As I explained, there was several studies done in partnership with the Ministry of Social Affairs, the Ministry of Finance, showcasing that universal child benefit is affordable and sustainable in the context of Tunisia if reform are implemented. So in 2019, UNICEF supported a feasibility study of the social protection floor to covering different aspects of universal coverage of social protection in the country, including the child benefit. So this study demonstrated that the cost of a universal child benefit in the country would be around 1% of the GDP of Tunisia, while the subsidies cost about, so in 2020, it was about 4% of the GDP. With the inflation, the economic crisis that the country went through in 2022 and 2023, the subsidies costed about 6 to 8% of the GDP, if I remember correctly. So if you put these two numbers in perspective, you can see that if even not a comprehensive reform of the subsidy system is implemented in Tunisia, you can easily finance the child benefit in a country like Tunisia. And here we are making the case for the child benefit for children under 5. So the cost of the child benefit for children under 5 is even less than 1% of GDP. And the feasibility study is referring to all children in contributory and non-contributory social protection scheme. So far, all the support from UNICEF and the World Bank has been focused on the 18% of the poorest household in Tunisia. So the cost of this social assistance scheme, so it's we call it from a technical perspective more a quasi-universal child benefit because it's a targeted child benefit. Is about $15 million US per year. So it's not a huge budget for a country for like Tunisia. I just wanted, before I give the floor to Aziz, I just wanted to underline that it's not only me working on this topic. There is a team with me. I want to mention Samir Abouzekri, who has been working on this topic since 2017, and he was the lead in the partnership with the World Bank, the agreement that was signed between the World Bank and UNICEF in 2017. He was leading also the feasibility study that was published in 2019. We have also Gabriela, Ines, Dora. We, as Aziz mentioned, technical assistants sitting in the Ministry of Social Affairs. Sana, Nama, Nesrin are all part of this effort from UNICEF side. Thank you. Aziz, over to you.
And Aziz, maybe before you start, I can also just add one more question so you can answer. So we had a question from Gabriel who asked, like, how can we achieve sustainable financing using the World Bank loans as catalytic funding that promotes government ownership? So maybe if you can answer that as well, that would be great.
Thank you, Anu, and thank you, Remy. Just to add two couple of elements on the sustainability financing of the social assistance. First, we have to have in mind that the social assistance on the whole is about 1% of the GDP today, including all the AMEN program. The part on the child allowance for 0 to 5 is less than 0.07% of the total GDP. So this increase don't make more risks on the financing of the budget and the fiscal space, first. Second, I think that it's more adapted, and if we see it on the share of GDP, which is increasing slowly, but increasing a little bit, is still limited, so there is no risk for that. The second point is that the anchorage and the buy-in from the government, it's already informed by the studies that Remy already mentioned, but they have also the national development plan, which includes the social assistance as a whole, including the social assistance, and I see it as also an enabler for making the reform. The needed reform may be on the energy or food products subsidies. If they want to remove partially these subsidies to replace by the social assistance or the compensation, they have to build the social registry with a huge coverage. So today we are about 30% of the total population, all the services included. So, and this child allowance, one of the benefits is that to strengthen the delivery system in terms of identification, in terms of payments, in terms of knowledge, also on the behavior and the needs. So they can top up easily, let's say, the compensation, and as they did during the COVID crisis in 2020, but also in 2021, partially supported by the World Bank in 2021. So they can easily make this top up and channel some support for the poorest and vulnerable people. And then, and the last point is the financial law in 2022, and they already integrate this on their budget. Today, it's by the external financing with the World Bank and the JICA, which are very competitive, and then they will take it from there and their own resources, at least for this social assistance program. I'm not talking about the piloted 6 to 18. It's another story, but I think it's the same scale related to the GDP. It's not very huge compared to the others' social intervention.
Great. Thank you so much, Aziz. Maybe we can just take a couple of questions for the Mongolia colleagues as well. So I think this is from Shani. And so we have talked about how the collaboration with IFIs have been very influential in supporting expansion of child benefits. But what can be the steps that can be taken at the earliest stage or the inception stage in terms of collaborating with IFIs? And this can, if you can answer from both the UNICEF and the ADB perspective, that would be good. And I think if what can we get more clarity on the system readiness that you had mentioned to facilitate additional financing? So over to you both.
Okay. For Mongolia case, the welfare system is like, going under development quite some time. But then really the COVID has brought us in a very short period of time. This system has to be, be ready for the rollout and then the cover and then the reach all the targeted populations, and then we have to retrieve all the data readiness, and then it's kind of as a goal of identifying the most vulnerable, and then also identify the system readiness, and then to see that how we can really roll out the system, at once. Now, the most important thing is readiness. Even the UNICEF, what we are flagging, the government is the monitoring of the e-systems, more of how we are towarding. Mongolia has a very good example. One of the countries that just, identification is not repetitive. It's just, the identification is only, clear, and then the pure identifier is not duplicable. So each and every registration, per person, we're just trying to see that, the benefits flow, etc. The welfare system also giving us a very clear example that, who's getting what, and then so identifying the transfers. And then the good thing is the financial systems. We had really worked with the Ministry of Finance. The back end of the vehicle is the Ministry of Finance. So through this, we were really saw the intervention, how the Ministry of Finance can be the, kind of a vehicle to push all the sectors, and then bringing all the donors, where's the gaps, and then identifying, and then, and then building the ownership, and then really bringing the Ministry of Labor and Social Protection ownership of this program, and then take it forward. So I would really like to say that the system readiness, we really have to, just to share that, I think we should really have to work with the Ministry of Finance so that our back end, the financial system, is very much clear. From where the money coming, how the system can be, the program can be sustainable, where's the gaps, and then where to even invest. For example, when the IT system is really, lagging behind, it needs improvement, they need immediately shifted the funding towards one another so that, where it can be really flow. So, and then Ms. Ichka will add up, I think, and then so I would really just, advocate that UNICEF and ADB had made a very much bigger role in enhancing and then bringing into another level of that this financial public finance is also a key role for this improving and strengthening social protection into the system. Thank you. Over.
Iktel, yeah, you want to add something?
Yes. I also would like to actually recognize the World Bank contribution to a child money program, because in 2020, in addition to ADB, World Bank also provided 5 million USD as child grants. But government has actually emphasized this program is very important and the most effective and the fastest way to reach the households. And they have contributed, for example, from the state budget, 295 million USD. This was really the largest program, largest social assistance that were directly reaching out to 80% of the population. Basically, every household with children, they were able to benefit from the program. And then one good thing is, because after seeing the importance and the effectiveness of this program, government still continued to implement this program, and they kept the amount of the child grant as 100,000. But at the inception phase of the child money program and the food stamp program, or this kind of like social assistance programs, it was a bit difficult, as Mukhtar said, to convince the government. And then even the kind of origin of these programs were kind of like a bit tricky. One could even say that it was even introduced just like, for the election purpose. But then it has been adopted as a national program. But initially, at the inception, it was very problematic to introduce, and there were a lot of debates, a lot of different views. For example, this needs to be targeted or it needs to be universal. And then over the years, government also changed their minds several times So initially it was like a universal program with a very small amount of benefits, and then it was benefits were increasing, and then they were increasing they made it like targeted program to 60% to 80%, and trying to target back to 20%. And then now I think it's it become formed to keep it as universal program, to reaching out to 100% of the children. So, basically to demonstrate the effectiveness of this kind of programs like child grant and benefits, is really important. And then once the policymakers and especially the budget makers would really agree and see the impact, they tend to continue. Yeah.
Indeed, that's very important, the sustainability of these interventions. So over to Michael, maybe for the closing remark. After these, after these rich insight and experience shared from Tunisia and from Mongolia. Over to you, Michael.
Thank you, Denis. And I want to thank all of you for participating in this so important webinar. The partnership between UNICEF and international financial institutions like the World Bank and the ADB, these partnerships have been identified by our evaluation as one of the most successful partnerships in social protection. And when we look at the ADB's new strategy for social protection, it calls for strengthening these partnerships even more. These are important not just for tackling child vulnerability and not just for promoting the profound developmental impacts that we see from these programs around the world. We are going to see a growing importance for these partnerships because of the growing evidence on child benefit programs as contributing to global public goods, including climate change mitigation and human security. Building human capital is a dual purpose investment. It not only helps countries adapt to climate change, it actually helps mitigate climate change. Smart economies are green economies, and these highly visible and valued benefits contribute to social cohesion and help build the demand for good governance that is at the root of tackling the crises of conflicts that we see growing around the world. So I'm really happy to see this excellent evidence of such strong partnerships. And we certainly look forward to seeing these kinds of partnerships growing stronger and more effective in the future in helping to promote child benefits and better social protection systems. Thank you, everyone.
Thank you, Michael. Thank you, everyone, as well. And I would like to acknowledge the participants. We were up to 91 participants, I think, at one point across the globe. So that's good. And all the material will be available on UNICEF website. And I encourage you to make link to your website, whether country website, the bank, EPRI. The better the footprint, the better it is. Okay, so thank you all, and wish you a nice day, nice evening, nice afternoon. Thank you.
Thank you. Bye-bye.
Thank you.